Now, before entering to the forearm, so let us go through another important structure, that is brachial plexus. You can expect some important questions from brachial plexus. So the brachial plexus, you take time and learn. That will be better because there are several multiple choice questions in relation with the brachial plexus. So to understand that, let me tell you, in the cervical and axillary region, you have a network of nerves. So in the upper aspect of neck, you have cervical plexus, but in the lower aspect of neck, you have brachial plexus. Brachium means arm, because the nerves arising from this brachial plexus area, that will be continuing, or that will be going towards the arm and forearm respectively. That's why we are giving the term brachial plexus. Brachium means arm. I'm sorry. So how exactly this brachial plexus is formed? The brachial plexus got various stages, like there is a root portion, then there is trunk, okay, then there are divisions, then there are cords, then there are branches. So these are the subheadings to be learned. So brachial plexus you can trace under these subheadings, then it will be very easy. Roots means on either side of neck, on right side and left side of the neck, you can expect the roots like C5, C6, C7, C8 and T1. So these are the spinal segments, cervical spinal and first thoracic spinal segments, which are contributing for the formation of brachial plexus. This is present on either side. From right side, it will come to the right arm, left side, it will come to the left arm respectively. So now these roots are joining in a peculiar manner to form the next stage, that is trunk. There are three trunks, upper, middle and lower trunks. Here you can go through. So the roots like C5 and C6, these two roots are joining together to form a trunk here. This is called as upper trunk or superior trunk of brachial plexus. But C7 alone will continue as middle trunk. C7 alone will continue as middle trunk. Further, C8 and T1 will join together to form lower trunk. So these are the three trunks. So we explained about the roots. Next we explained about the trunk, upper, middle and lower. C5 and C6 join to form the upper trunk. C7 alone will form the middle trunk. C8 and T1 will continue as lower trunk respectively. Further, if you trace it, each trunk will be divided into divisions. For an example, this is the upper trunk. It will divide into anterior division and posterior division. Here, anterior division and posterior division behind. This is the middle trunk. It will divide again into anterior division and posterior division, which will go behind. Further, this is the lower trunk that also will divide into anterior division here and the posterior division behind. Okay. So now the brachial plexus, this will be reaching to the axilla. So the brachial plexus got supraclavicular part and infraclavicular part. So this is the part of the brachial plexus here in the axilla. In the axilla, you have an artery called as axillary artery. Additionally, along with that, you can expect the axillary vein and further parts of brachial plexus, axillary pad of fat, axillary lymph nodes. Like that, several contents are there in the axilla. Now listen me, why specifically we stress around the axilla? Because next stage of the brachial plexus will be the cords. We have three cords, lateral cord, medial cord and the posterior cord. The naming of these cords are purely based on its relationship with axillary artery. For an example, the cord of brachial plexus on lateral aspect of axillary artery is called as lateral cord of brachial plexus. The cord of brachial plexus related to the medial aspect of axillary artery is called as medial cord of brachial plexus. Further, the cord of brachial plexus, which is behind in the posterior aspect of axillary artery, is called as posterior cord. So now let us discuss the cords, lateral, medial and posterior cord. So this is very clear. Posterior division of all the three trunks, upper trunk, middle trunk and lower trunk. All the posterior divisions are joining to form the posterior cord of brachial plexus, that is behind the axillary artery. And again we have anterior division of upper and middle trunks joined together to form the lateral cord of brachial plexus, which lies lateral to the axillary artery. And again, we have the anterior division of the lower trunk that will continue as medial cord of brachial plexus. Medial cord of brachial plexus, which will be lying on medial aspect of axillary arch. So this is how the cords are formed. Further, you have various branches. So the branches can be, most of the branches are from the cords of brachial plexus. That means there are branches from the lateral cord, there are branches from the posterior cord, there are branches from the medial cord. But I have simple technique to remember how exactly these branches are in order to avoid confusion. And based on these branches, you can expect several multiple choice questions also. So if you are very familiar about these branches and it's a trick to remember, you will be all right. You can opt the right answer. So now let us see how to learn these branches. Remember, most of the branches are from cords. How many cords are there? There are three cords: lateral cord, medial cord, and posterior cord respectively. So now you could remember the branches from lateral cord. You can remember a mnemonics LML. LML Vespa, the two-wheeler, you can remember LML. That means lateral root of median, musculocutaneous, and lateral pectoral. So to remember that, you should identify one nerve first.